warm welcome to our channel. Today we're going to discuss about the cardiac function test. That is the clinical biochemistry test. We need to understand that how the test is happening, as well as what are the parameters, what are the purpose, and what are the normal range. We are discussing the particular things within a very short time so that you can take the overview of the cardiac function test. See, just subscribe our channel for daily classes and join our WhatsApp group for the particular notes. Okay, and you will get the link of the particular groups as well as any kinds of queries. Link you will find out into the description box. Just check it out. See, first one is that we need to understand that why we are doing the cardiac function test, as well as what is cardiac function test. Cardiac defining that it always seems like a heart, right? Cardiac defining that heart, function defining that it's occurring properly or not. So that we have to do some test which is related to the heart, and after doing the particular test we can identify that our heart is working properly or not. See, first one is the we can detect the myocardial damage, we can detect the ischemia condition, we can detect the any kinds of heart related disease. Okay, so that these kind of things we have to detect. For detecting the particular things we have to do some test. That's all are related to the cardiac function test. Got it? See, first one is that to detect the myocardial infarction. First one is the myocardial infarction. Second one is the myocardial infarction, defining that when the myocardium layer, where basically the blood vessels basically found, whenever the inflammation of the myocardial layer are happening, that basically as well as the myocardium layer become dead, it's basically cause the myocardial infarction. First one. Second one, see here, to evaluate the cardiac muscle damage. If any kinds of cardiac muscle become damaged, that's basically we know that there have four types of muscle. There is a cardiac muscle is all, one of the most important muscle which basically help to pumping the particular heart so that the blood become pumped properly. Okay, after that, to monitor the therapy in the cardiac patient. Okay, after that, screen individual. If any kinds of heart related disease, we have to screening the particular disease. That's all are related to the cardiac function test. Okay, now we are coming, what are the marker of the cardiac function test? Just see the overview. I will elaborately discuss the particular things one by one, then you will understand it properly. First one is the CKMB. See here, if you are noticing here, that is a CKMB. Second one is the troponin I or troponin T. Third one is the lactate dehydrogenase, or in the short form we may say that LDH. Fourth one is the myoglobin, and fifth one is the SGOT. Got it? This all are the marker of the cardiac function test. Okay, we have to discuss the particular things one by one, then you will understand it. Here is also one chart, when it's rise, when it's peak level, and when it's return level. We will discuss it later. Firstly, we need to understand the whole things one by one. See, first one is the creatine kinase. I am again saying you that it's the overview of the cardiac function test within a very short time. I cannot cover the whole methodology in elaborate way, so that I have to say the particular things in very shortly. You have to take the idea how the test is happening, what are the markers. See, first one is the creatine kinase. If you are noticing here ASE defining that should be enzyme, right? ASE defining that should be enzyme. Please keep in mind that. See, this enzyme basically founded into the cardiac, means heart and skeletal muscle. Got it? So that whenever any kinds of myocardial infarction basically happening, this enzyme become elevated, because this enzyme are related to the heart, as well as this enzyme are released from the heart. Got it? The normal level, that is the 0 to 24 international unit per liter. Okay, elevated level means whenever it's elevated, first one is the myocardial infarction, the death of the myocardium layer. I have already already told you that. After that, myocarditis, it is also one type of inflammation related to the heart. Okay, in this condition they become elevated. After the estimation method, how to you estimate the creatine kinase? First one is the immunoinhibition method. Second one is the electrophoresis method. There have also lots of another type of method. You might perform it within the cardiac function test to understand as well as to identify the level of the creatine kinase. Okay, total whenever the total creatine kinase level 6%, more than 6%, it's basically defining that the cardiac origin is damaged. It basically defining that from where the creatine kinase basically formed, the particular area become damaged. Okay, so that's the creatine kinase. After that, now I'm coming to the troponin T and troponin I. Please keep in mind that troponin T, troponin I, and troponin C and actin, tropomyosin, that's all are the protein. Please keep in mind that that's all are the protein. They are founded into the muscle. Okay, see, they all are founded into the muscle. What their functions are? They basically help to contraction of the cardiac muscle. Without this kinds of protein, cardiac muscle cannot be contracted, because we have to understand how it's the contraction relaxation are happening. You have to understand it into the uh, muscular system as well. Okay, see, first one is that it's the most sensitive and specific marker for the myocardial damage. Okay, second one, see here, this protein are involved into the cardiac muscle contraction. I have already told you that the cardiac muscle contraction required this kinds of protein. After that, trop T, you might see that trop T is one type of test as well for the cardiac function test. Here is a troponin I appears 3 to 4 hours after myocardial infarction. Okay, troponin I basically appears whenever the myocardial infarction are happening after 3 to 8 hours. First one. Second, you see here that basically persists 5 to 10 days. Okay, this troponin I whenever elevated, you might see 5 to 10 days they become stated in a complete elevated state. Okay, after that, that basically uses and high sensitivity for the troponin assay. Nowadays we are doing the particular things for the modern diagnosis. Please keep in mind that. Okay, that's all are the troponin T and troponin I. After that, we are coming to the lactate dehydrogenase. What will you need to remember? That you need to remember the name of the marker, when it's elevated, when it's peak level, what are the normal range. Okay, and which kinds of methodology, from where they are formed, and whenever they are elevated, which kinds of disease might be occurred, you might see. Okay, there have LDH, there have 5 isoenzyme: LDH1, LDH1, LDH1 to LDH5. Okay, there have five uh, isoenzyme basically present. Okay, that's the lactate dehydrogenase. Please see, uh, all tissue in the all tissue are contains with the lactate dehydrogenase, especially heart, liver, muscle. Okay, see, that's all are the isoenzyme. LDH2 is greater than LDH1 isoenzyme. Okay, that basically indicate the flipped pattern seen into the myocardial infarction. Into the myocardial infarction, you might see the flipped pattern. Okay, peak activity 48 to 72 hours after infraction. Within 42 to 72 hours, it basically elevated. Okay, and you will find out the level become completely peak. Got it? Is help to diagnosis the myocardial infarction. And troponins is inclusive. Please keep in mind that lactate dehydrogenase is also help to identify or diagnosis or measure the myocardial infarction. Okay, that's all are related to the lactate dehydrogenase. Now I'm coming to the another enzyme, that is myoglobin. It's not the enzyme, it's one type of protein. This protein help to supply the oxygen, supply the particular nutrition, supply the uh, particular energy to the muscles. That is called myoglobin. Okay, like they are looking like, as well as they are working like the hemoglobin in the muscle. Got it? That is the earliest marker. Okay, it's a very earliest marker. So that rise within 1 to 3 hours after myocardial infarction. It should be elevated in 1 to 3 hours within. Got it? After that, short duration. Within a short duration, they basically elevated. After that, they are coming to the normal level or normal level, that is within 24 hours. Got it? After the sensitive but not specific, yes, it's basically elevated whenever they are increases, but they are not that specific marker. Means whenever the myoglobin become increases, you cannot see that the myocardial infarction is happening particularly. You might say that myocardial infarction is happening, okay, but you cannot say that specifically the myocardial infarctions is happening. Got it? After that, they basically also rise also into the skeletal muscle injury as well. Okay, early screening cardiac injury. Whenever the cardiac injury are happening, then that is the early marker. That is myoglobin. It's one type of protein. Okay, that's all. After that, SGOT. This SGOT you might find out into the liver function test as well, but is this SGOT basically founded into the cardiac as well, as that is also the cardiac marker. We also say that serum glutamate oxaloacetate transaminase, or we can say that aspirate transaminase. That is a previously used marker, now it is not uses. Okay, non-specific. Non-specific means we cannot detect that myocardial infarction is happening particularly. Okay, now replaced by the troponin and CK. Now we are not doing the SGOT test too much highly, but we need to understand because this SGOT basically founded into the heart and muscle as well. Okay, elevated into the skeletal muscle. Skeletal muscle, I have already told you that that is the muscle. Liver disease, myocardial infarction, and liver disease, that is also the marker of the liver function test. You might find out that SGOT, SGPT, GGT, gamma glutamine, ALP. Okay, additional investigation, you might do the ECG. That is also help to understand that your heart condition is good or bad. After the echocardiography, you might understand that, as well as you might do that for understanding the structure and the motion of the heart. Lipid profile test, it will help to understand, as well as it will help to giving you the overview risks of elevation into the heart. After the CRP, C reactive protein, as well as high sensitive CRP, that basically one type of marker which basically help to uh, identify if any kinds of inflammatory disease as well as inflammatory conditions are happening or not. Okay, after that, see, now we are coming to the see, we have already understood, right? We have already understood the full form as well as what are the important. Just look down upon the particular things. Okay, we have already understood cardiac troponin, highly specific and sensitive, late lactate dehydrogenase, late marker and confirms the MI. After the muscle oxygen binding protein, that is the myoglobin, reacts in quickly. After the aspirate amino transferase, a non-specific supporting marker. That's all are the thing we have already understood. Now it's a high time to discuss about that. What are the rises level? What are the peak level? What are the return level? See, there is in the another side, left side, basically defining the marker. Rises level means whenever the disease might be happening, they become starting to rise. Peak level defining that they will come into the peak state. See here, into the peak state, that is the peak level, and return level means they will come into the normal level. That is the things. Okay, that is the things, please keep in mind that myoglobin rises 1 to 3 hours, peak level 6 to 12 hours, and return within 1 day. First one. Second one is a CKMB, rises 3 to 12 hours. after that peak level within 24 hours, after that return 2 to 3 days. Okay, after that please keep in mind that that is a troponin I that basically rises within the 3 to 8 hours, peak level 24 to 48 hours, and the return level that is 5 to 10 days. Okay, and last but not the least, that is the LDH that is rises within 12 to 24 hours, peak level 48 to 72 hours, and return level 7 to 10 days. Okay, that's all are the marker, their rises level and their normal range. That's all are the things related to the cardiac function test. Understand them and diagnosis better and save the life. Okay, best wishes from our channel. Just you have to like, share and subscribe for daily classes. Okay, and if you want to attach with our platform from your educational purpose, that might be you are doing what you are working, or you are a student, you require tuition, you require competitive exam guidance, you require master degree guidance, any kinds of things you might contact with us. Every details are basically present into the description box. Just subscribe our channel and look down upon the description box. Thank you so much for attending. Have a great day everyone.